This has been a big discussion in terms of COVID vaccination policy, specifically with respect to the bivalent boosters and the current recommendation of the CDC and the U.S. government that you go ahead and get a fourth or a fifth booster. So currently there has been a, quote, flag signal. The CDC and FDA have announced on Friday that their surveillance system flagged a possible link between the new Pfizer biotech bivalent COVID-19 vaccine and strokes in people that are age 65 and over, specifically in the first 21-day period, raising a question in the surveillance mechanism of whether that stroke risk was elevated as opposed to days 22 to 44 post-vaccination, according to the CDC website. This is specifically from the CDC's own data for everybody, including YouTube who is listening out there. CDC's vaccine safety data link met the criteria warranting further investigation into whether the bivalent Pfizer vaccine led to a higher risk of ischemic stroke, which occurs when arteries pumping blood to the brain are blocked by a blood clot. Both Pfizer and biotech said in a statement, quote, there is no evidence to conclude ischemic stroke is associated with the use of the company's COVID-19 vaccines. To also be clear, immediately afterwards, the CDC put out a statement. Let's go to the next one up here, please, where they say that it is, quote, very unlikely that the booster carries a stroke risk after launching a review. However, that came just 24 hours after all of this. Why does any of this matter? This is a perfect example of why lack of censorship around discussion around these topics is very important, specifically with regards to the bivalent booster vaccine. Like, you can even put the original vaccine aside. The case for the bivalent booster was that it would specifically target Omicron and provide you better protection. We now know from a host of studies that have been done independently. If you are questioning this, I've done a monologue on it. Dr. Vinay Prasad, who we've had on the show, has written about this extensively. There is no difference in the amount of coverage that the bivalent booster provides people. Now, that doesn't mean necessarily that if you're old or if you're obese or you have a pre-existing health condition, in consultation with your physician, that it may not be a good idea to get it because COVID could be particularly bad for you. But to then say, as we have seen now, multiple universities and colleges mandate that young people receive, in some cases, a third or a fourth shot just to be able to step foot on campus is totally absurd whenever you consider even the small risk signals that can be in there around myocarditis. And I think the discussion you are having right now, Chris, or you and I are having right here with this right now, we know that it's trepidatious, even in the current environment. And that's exactly what the problem is. Like, as you said, look, you know, these things change. In terms of the vaccine signal and its efficacy and all of that, it was one thing when they released it, and then the virus changed, and then, well, it was a whole other discussion around lack of prevention, what it means, can it stop transmission? We have to have the ability to have an open and honest conversation, because I could say with certainty that the way that the vaccine was sold is not how it ended up working out. I don't know if it was malvalent. I don't know if it was just lack of data. I like to presume good faith in general, but the point is that even having that discussion, I remember it very vividly at the time, it was very difficult, you know, in order to have with folks, especially after I got my, quote, breakthrough case. And I was like, well, you know, I got some questions around what exactly is going on here. And that's fine. That's normal. And also reflected in the data, only 4 to 5% of Americans have even received the bivalent booster after the U.S. government requests that everybody get it. I mean, if 95% of people are telling you no to a quote-unquote government advice, it also shows a collapse of faith in the overall architecture.
I think people just have a lot of questions about how much they really gain from this one.
Yes.
Like, does this really, is this really worth it? And I think those questions are entirely legitimate. A couple things to note about this early signal. Number one, it is exactly that. It's an early signal for further investigation. It's not definitive or anything close to that. So I think that's important to point out. They actually didn't see this same warning signal in the Moderna vaccine. So if you have concerns and you were thinking about getting the vaccine, perhaps go with the Moderna one until they sort all of this out. And then the other piece that I think is important here that you're pointing to is, you know, the problem with the public health officials the whole way was that they really didn't trust the American people to actually be presented with the data and the facts as it is, whether it was with regards to face masks or herd immunity or a number of other things, and be able to cope with that in a reasonable way. And because they sort of, we'll say, massaged the facts and at times outright lied to the American people, then that did degrade the trust of the American people. And it became a vicious cycle, because then when the people didn't do what the public health officials thought they should do because they didn't trust the public health officials, then there was even more of an effort to, okay, well, we got to clamp down even more, and we can't trust these people even less. And it led to this sort of vicious feedback loop. So what we know at this point is, number one, there's this early signal that they're going to investigate. And number two, this was also, something we covered here and Dr. Prasad talked about, and you talked about as well, Saagar, is that these particular boosters received very limited testing before they were pushed down. Now, that's not a different protocol than what is normally used for boosters or other sort of like flu vaccines and other things like that. It was the standard procedure, but I think it's worth, as we're having all of these things stress test, to look at the procedures and say, was this appropriate here? Is it appropriate in other instances, or is this creating unnecessary risks that don't make sense ultimately?
Am I the only guy who's shocked that all they need is to show some increase in 8 mice in order to approve a flu vaccine for everybody? I mean, honestly, I was. Look, maybe there are much smarter doctors and immunologists than me that can tell me about why exactly that's actually a totally fine procedure, et cetera. But I mean, one thing that we all learned from this, our interview, actually, I always recall with John Abramson, specifically talking about how peer-reviewed studies are based on data provided by pharmaceutical companies and how they can even hold back anything that they don't want necessarily to be peer-reviewed. And so that means that even the, quote, peer reviewers in Science or Cell Journal or any of these other prestigious publications, they don't even have access to the raw systems. I mean, the level of control that I think that many of these companies had, it was one in which we all kind of presumed good faith-ish. But, in general, people trusted the doctors. The doctor's like, hey, you should get the flu vaccine. I'm like, okay, whatever. I don't think about it. They're like, but then, I'm reading this. I'm like, well, hold on a second. I'm like, what's going on here? It's like, is this how they all work? I'm like, what is the actual efficacy? And I think the crowdsourcing of questioning all of this has made a lot of these people really uncomfortable because it's shaken that trust. And on an individual level, there are many doctors out there. I'm sure it's a pain in the ass. I know many doctors watch our show. I'm sure it's a pain whenever people come to people like me or like, oh, what do you mean by that? Well, how does this work, et cetera. But, overall, like it's not necessarily your fault. It's the fault of, the people at the very top, but it's still a problem that we all have to deal with. So anyway, I think it's a very important discussion topic. This is one that we'll continue to watch. We're going to try and have Dr. Prasad back here on the show just to explain everything that is going on with regards to policy and all of this and why it even matters. And the point is, though, is that from the first segment, you had to be able to have these discussions. Because otherwise, the breakdown right now in social trust is catastrophic. Another key Dr. Prasad point, already people are wholesale rejecting the MMR vaccine for their kids. Measles is out of control through the roof right now because they don't trust vaccines, period, as a result of a lot of the COVID policy. You could say they're idiots, but, that's not going to change their mind. So we got to come to something here, or we're going to have even more catastrophic public health problems as we go forward.
Hey guys, ready or not, 2024 is fully upon us now, and Saagar and I have been brainstorming ways that we can really up our game for this critical election.
Yeah, we rely on our premium subs to expand our coverage, to add staff, to upgrade the studio. We just want to give you the best independent coverage of this election, which is possible. So if you can help us out, become a premium subscriber today, breakingpoints.com, or the link is down here in the description video. It really means the world to us, and if you like what we're all about, this is the best possible way to keep us 100% independent, working only for you.